Thank you for coming. First off, I wanted to introduce my colleague Mark Paulson. Mark is going to help present our discussion today, and I wanted to find out if there were any English speakers that would be willing to assist in some translating in our presentation today. If that's, I'm not sure if there's anyone that would be able to help us out with that. Can someone help translate for us? English is okay? Okay. Well, here we are at MedTec, and we wanted to talk about the fabricating of silicone rubber products, specifically for combination products. Essentially, there's many advantages to using silicone for combination products, and it's something that we're very excited about as we're moving ahead in terms of the opportunities and the different applications that are out there, specifically involving silicone as a platform for combination products. So today, through our discussion, I want to talk a little bit about the advantages of combination products as a whole, understanding a little bit more about the industry, and then we're going to go into some detail on why silicones are involved in combination products, talk a little bit about material selection that you would use, and then wrap it up and talk a little bit about the steps that we go through in making a silicone-based combination product. I think first off, it would be best to break this down and define exactly what it is we're talking about here as far as what is a combination product. And as is described on the slide, it's two or more regulated components within what the FDA looks at as far as a drug, a device, or a biologic. So any combination of those two elements, or certainly all three of those put together, and then manufactured or provided to the healthcare community as a single entity. Another, maybe better way to describe exactly what it is that we're talking about pictorially here is the combination of, right there, drug and device is primarily what we're going to be centering our discussion around today. But it could be a combination of all three as well, but that's essentially what we're talking about as far as a combination product is concerned. So, yeah, just use it.
There are certainly advantages, therapeutic advantages in combining a drug and a medical device. And today, we are going to limit ourselves to implantable drug device products and transdermal products. There are indeed other types of combination products. These involve pre-filled syringes, oral inhalers. That's really not the focus of our attention today. We're looking at implantable drug delivery devices, or in some cases, transdermal. There are several advantages of drug device combination products when compared with standard routes of drug delivery. Perhaps the first is that you get a controlled release of the drug versus a bolus type delivery that you might get with an injection, infusion, or even a daily oral tablet. In the case of implantable drug delivery devices, you get very targeted delivery. In other words, if we are treating a cancer tumor, we can implant a drug device in the very vicinity of that tumor and target drug delivery to that tumor. This is quite revolutionary. At the same time, we can deliver higher therapeutic doses with minimizing side effects, minimizing systemic toxicity. So this new technology allows us to deliver more drug to the target while doing that safer. And finally, and I think this is very important, in both China and our country, the United States, the population is getting old. And most people would agree that as the population ages, patient compliance becomes more important. Taking your medication, taking your eye drops. In many ways, combination products certainly aid in patient compliance. That's very important. A little graphic here, if I wasn't clear earlier. Here we can see that as compared, you see the sinusoidal wave here. You might think of that as we get up in the morning and we take a pill. And the pill gives us a high therapeutic effect, but also some side effects. Later that night, the therapeutic benefits decrease, and of course we don't have side effects. But what is unique about combination products is that it allows us to maintain therapeutic delivery within a very narrow range, maximizing therapeutic activity while minimizing side effects. Finally, before giving it back to Paul, I'll just talk briefly about the commercial advantages of combination products. I like to look at this in two ways. The combination products, these drug-device combinations, are interesting to two groups. First, the medical device industry, and second, the pharmaceutical industry. To the medical device industry, it allows them to often take existing devices and do it better. Two examples come to mind. On pacemakers, you know, that the wire that goes into the heart to deliver a constant electrical charge. Those have been around now for about 30 years. About 15 years ago, companies began putting little drug tips at the end of those pacemakers, often a drug called dexamethasone sodium phosphate, to reduce inflammation. So there's an example of a medical device company looking for a way of building a better device and doing it with this drug-eluting tip. Another example that we all probably understand is a stent. These metal devices that keep vessels open. They've been around for some time as well. They began as what are called bare metal stents. It was understood that they suffered from tissue ingrowth or restenosis, and hence manufacturers now are adding drug coatings to those stents to create drug-coated stents. So those are the advantages. Those are two examples of medical device companies have improved their devices by including a drug delivery component. Briefly then, let's talk about the other group that has an interest in combination products, and this is the pharmaceutical sector. You know, it's been shown that 5 out of 10,000 drugs that are investigated are abandoned. And historically, it's shown that only 1 out of 10,000 drugs becomes commercially viable, that it's approved by the SFDA or our FDA. And so there's an example of the drug companies now are looking at these drugs that were abandoned, the 9,999 out of 10,000. Drug companies are reevaluating these to see if they can be useful as combination products.
So overall, one of the reasons from a business standpoint that we decided to go after this segment of the marketplace was primarily due to the growth that we see and that has been shown in the industry over the last few years. We see that in terms of all the market research that we've done, we see the growth of combination products at about 14.5% projected over the next 5 years. Whereas the medical device industry, strictly as devices themselves, are only working or projected to be at about a 9% growth, where the pharmaceutical industry itself is slightly less than 2% growth. So overall, we look at the industry as very promising and holding a lot of opportunities, specifically for some of the reasons that Mark mentioned, about finding new and novel approaches of delivering drugs that have already been approved and are moving forward. So here, now we're going to bring into and talk a little bit why silicone is such a good choice as a platform for a combination product. First off, silicone has over a 50-year history as a bioinert and biostable material. So it's probably the most tested and most used biocompatible material in the industry and in the marketplace today. You have the ability to formulate silicone as an elastomer or as a gel. So as our colleague from Blue Star showed in his presentation a few minutes ago, there's many transdermal applications, skin contact applications that exist, as well as implantable applications. And then specifically, the molecular chains, the backbone that makes up silicone, the silicon-oxygen chain that forms that, these polymeric chains have very weak forces holding them together. So essentially there's a tremendous amount of free volume within the silicone molecular structure, which allows it to act as a reservoir and holding the drug, and then allowing it to elute out with that targeted therapy in the body. And finally, the last 2 points on this slide, the various vulcanization mechanisms along with the multiple fabrication techniques, those allow you to form these products into any shape or any size, whether you're talking about a transdermal patch or an implantable application. So let's talk a little bit more. I'll let Mark talk a little bit more about the various vulcanization methods.
Silicones may be unique in that they offer different families of cures here. There are a couple of these would be peroxide. This is not commonly used with drugs due to its high vulcanization temperature. It initiates at temperatures well in excess of 200 degrees C. Another type that is being investigated for drug delivery are what are called RTVs, room temperature vulcanizing materials. These can be oxine, acetoxy, or alkoxy, each with their own benefits, but these materials do cure at room temperature. Disadvantages would be that they cure very slowly. And finally, the materials that SSF is working most with in drug delivery right now are what are called platinum catalyzed addition systems. These materials typically cure at elevated temperatures, but as we'll show in a little bit, that temperature, the time temperature combination can be adjusted so that you can work with most drugs. I guess what I didn't add here is that these drugs, or these active pharmaceutical ingredients, tend to be unstable at high temperatures. So one of the real concerns we have is choosing a silicone vulcanization, choosing a material and the process that allows us to cure the silicone below the decomposition temperature of the drug. This is kind of interesting. I hope I can do it justice in explaining it. The Arrhenius equation suggests that a reaction that happens at one temperature will happen twice as fast when that temperature is raised 10 degrees Celsius. This is some work that was done by SSF. I think it was quite even revolutionary. I haven't seen this graphically represented before, but on the top graph there, we've taken a 50 durometer silicone HCR and have vulcanized it at temperatures from 90 to 140 C. By the way, this type of plot is called a rheometry, and we're measuring the cure rate over time, and we're depicting the cure by measuring torque here. So there you see it. The 5 different temperatures produce different cure rates. On the bottom, we've taken one representative variable, if you will, that being T90, the time at which these materials were 90% cured. And we plotted them both theoretically and empirically, and you can see that the silicones do in fact correlate well with the Arrhenius equation. We say that a little bit differently. It suggests that there is a time and temperature combination. In this case, anywhere from 90 degrees C to 140. We can choose a time to completely cure the material. And this is an advantage for certainly curing that silicone with different API.
And more importantly, specifically when you're talking about drug and silicones mixed together, you have to look specifically and monitor that overall temperature so you don't have any degradation for the efficacy of the drug. Now, once we've looked at the different materials that we have available, we have to look at the final geometry that's required for this drug-device combination. So then we have the ability to either mold that, extrude that, coat it, or generate some thin films that maybe go on the skin as like a transdermal patch. Molding, if I go back to molding or touch on that for a second, we can mold over a product if there's a frame. Maybe it's a metallic or a plastic frame, doing insert molding. That would be another technique that we could use to manufacture a product that someone is interested in bringing to the marketplace. Calendaring, of course, silicone sheeting is also widely used in many instances. Once you take that silicone sheet, you would then die cut a particular shape out to get the ultimate form that you're looking for in the end. And we're going to, I'll let Mark then wrap up with the overview of how we would go about outlining and initiating a product once a drug has been identified.
Regulations in the United States demand that when we receive an active pharmaceutical ingredient into our plant, that despite what is said on the label, we must somehow confirm that the drug, typically a powder, is indeed what it says on the label. We've recently added an in-house analytical capabilities so that we use FTIR as a confirmatory test to demonstrate that indeed the drug is what is said on the label. So this is a very important point, that you confirm the drug identity. I kind of touched on this before, but most drugs are unstable at some temperature. It's important for us to determine what that temperature is so that we can set a process that handles that drug safely. To do this, we typically, unless our clients can advise us as to the maximum temperature, our preferred method is differential scanning calorimetry. This allows us to get a snapshot of drug stability at different temperatures such that we can pick a time and temperature where we know the drug is stable. The next part is knowing that temperature, the temperature stability of the drug. We then select an optimal silicone material. And again, I suggested earlier, the two most commonly used are what are called RTBs and these platinum systems. And that silicone would be chosen for several reasons. Several factors would go into it. Number one is API compatibility. Is the silicone compatible with the drug? Is the cure process compatible with that drug? Different silicones contain different formulations. For example, the amounts of silica would vary material to material, and that can have an impact on drug elutions. So elution rate will factor into our thinking on which silicone we want to use. And then finally, we'll ask ourselves, well, how are we going to fabricate this? Certain types of materials lend themselves to certain types of fabrication. So all these things go into our choice of which silicone to use. I can't emphasize enough how important one element of any process is that concerns a drug and silicone, and that is the mixing technology. In fact, we are only as good as we are competent in mixing and making a silicone drug mixture 100% homogeneous. And our company has in fact invested heavily in mixing technology. We've got mixers that work actually on high frequency sound, which is kind of an interesting technique. We've got other mixers that mix via producing what's called asymmetric dual centrifugal shear forces. So suffice it to say that mixing is important, choice of mixer is important based on the material. We also then optimize the mixing process. This is discussed before. This is primarily determining time and temperature in order to completely cure the drug and silicone mixture. And then finally, it's important that working with our clients that we develop lot acceptance characteristics, lot acceptance requirements. This can involve visual standards for the finished part. It can also involve mechanical properties, but probably most importantly is the drug elution characteristics. And that is typically measured using equipment such as high-pressure liquid chromatography. That is it. I hope I was able to convey some interesting information to you this morning. Any questions?